In an early stage of colorectal cancer, you will not notice symptoms. If you have symptoms of colorectal cancer, you must see a doctor. The number of colorectal cancer is increasing worldwide, and it is possible to invade your body already. Make sure you understand the characteristics and symptoms. Hello, this is Physician Supervised Preventive Medicine TV. This time, I will talk about the theme of the 4 initial symptoms of colorectal cancer you should never ignore. Let's get started. First, let me briefly explain about colorectal cancer. Intestines of the human body are roughly divided into small intestine and a large intestine. An intestine closer to buttocks is the large intestine, and we store our stool here. Cancer is more likely to occur in the large intestine than in the small intestine. Storing stools will increase the number of intestinal bacteria, and the harmful ones will cause cancer. Therefore, cancer is more likely to occur in the large intestine than in the small intestine. So, what are the causes of colorectal cancer? Main causes are smoking, lacking exercise, and drinking a lot of alcohols. People who have these habits increase the risk of getting colorectal cancer. In addition, it is related to a strong genetic component, so if your family or your relatives have colorectal cancer, you need to be especially careful. According to a report, colorectal cancer is one of the top 3 cancers for getting both men and women, so it could happen to anyone. Then, let me explain the symptoms of colorectal cancer. By the way, this channel provides evidence-based medical and health information from a doctor's point of view, so I believe it will be useful for you to subscribe it. The 4 initial symptoms of colorectal cancer you should never ignore. First, it is a weight loss. If you are on a diet and reduce the amount of food you eat, it is reasonable losing your weight. But if you are not on a diet and losing your weight, you should be careful. When cancer invades you and the cancer cells stay in your body, they seek nutrients to survive. They destroy and use your proteins and fats as their own nutrients. This is a mechanism of decreasing your weight and energies. If the cancer cells grow fast, you may lose 10 kilograms in 2 months. Sudden weight loss without proper reasons, please see a doctor. The 4 initial symptoms of colorectal cancer you should never ignore. Second, it is a constipation. The large intestine is a path of your stool. After food is digested and broken down into a stomach and duodenum, it is passing through the small intestine. Substances that are not necessary for your body will be a stool in the large intestine, and it is going to be excreted through the anus. At this time, if there is a cancer inside of the large intestine, it will narrow the path of your stool. Therefore, the stool cannot easily pass through it, and that will lead you to be constipation. If the cancer is too big, the stool will not be able to pass through, and these will be accumulated inside of the large intestine. That will cause abdominal pain, and it would turn to a condition of bowel obstruction, which the stools are stuck in the large intestine. In the worst case scenario, the abdominal pain could get worse, and you will be transported to an emergency room for surgery. If you are having severe constipation, please see a doctor as soon as possible. The 4 initial symptoms of colorectal cancer you should never ignore. Third, it is a bloody stool. I already explained that cancer cells deprive your nutrients in order to survive. But cancer cells also create their own blood vessels to feed their own cells. This is called neovascularization. Blood vessels of the human body are made tough and solid, but the new blood vessels being made from neovascularization are a little fragile. Therefore, when stool passes through the large intestine and hits the vessels of neovascularization, it will cause bleeding easily. This is a mechanism of how bloody stools could be made from neovascularization inside of the large intestine in colorectal cancer patients. Hemorrhoid is also cause bloody stools. But if you don't have a hemorrhoids problem and see bloods in your stool, you should go and see a doctor immediately. Sometimes you may not actually notice blood in your stool. However, if you test positive for fecal occult blood test, there could be a tiny bit of blood in your stool, so be sure to check up with your doctor. The 4 initial symptoms of colorectal cancer you should never ignore. The 4th and last, it is a dizziness. Why is dizziness related to colorectal cancer? Those who thought it like this, you are very sharp. Right, actually, dizziness is not directly related to colorectal cancer itself, but it is not uncommon to be found the cancer from a symptom of dizziness. In short, the cancer causes anemia and it leaves this dizziness. As I explained earlier, the neovascularization is so fragile, and it could easily tear and bleed. Because of that, colorectal cancer patients lose more and more blood from their stools. That is how anemia is progressing to them, and dizziness may occur as a symptom of this anemia. Depending on the severity of anemia, blood transfusion may be required. Even if you can avoid the blood transfusion, this anemia often leads iron deficiency, so you may have to take an iron pill. To improve anemia and treat colorectal cancer early, please don't ignore the symptom of dizziness. These are frequently seen initial symptoms in colorectal cancer. However, in many cases, colorectal cancer has been progressing already, even if it is found in an early symptom stage. So, is there a way to find colorectal cancer early? Fecal occult blood test in the health examination is an effective way in order to detect colorectal cancer before such the symptoms. After this test became available, it is said that the mortality rate of colorectal cancer has decreased by 16%. Colorectal cancer is likely to occur in people who are over 50 years old. Young people are unlikely to have colorectal cancer even if they are tested positive for the occult blood test. But if you are over 50 years old and get the occult blood test positive, you should take a colon camera examination to see whether it is malignant or not. I talked about the initial symptoms of colorectal cancer you should never ignore today. I am looking forward to seeing you again.